Hey there, my name is Amber Brown, and I am very excited to talk with you today and share a little bit about what I do and how I got here. My area of expertise is in public health nutrition, especially in maternal and child health. Most of my professional background has centered around the WIC program in one way or another, either directly or indirectly. I graduated from Utah State University, where I completed the coordinated dietetics program. And yes, I did graduate with Professor Day. She is amazing, and you are all seriously so lucky to have her as a teacher. She's great. So, after I graduated, like many of us, I took the first job I could get, and it just so happened to be in public health through the WIC program. So I started off in local clinics in Salt Lake City. And after about 2 years, I transitioned to the state level WIC office, where I stayed for about 6 years, where I did more administrative tasks and was kind of the go-between between like the federal government and our local WIC clinics. Now, for the last 7 years, I've worked as a consultant, and I absolutely love it. Most of my work is with the Association of State Public Health Nutritionists. It's also called ASPHN for short. It's a professional organization with about 1,000 members who all work in public health nutrition all across the country, um, and just kind of helps kind of connect them, helps provide opportunities for them, things like that. So, what exactly does public health nutrition include? I know when I was in school, we didn't get a lot of information about public health nutrition. Most of it was just geared towards like WIC and SNAP. So it may be more than you think. So obviously WIC and SNAP that I just mentioned, it can also be working in the child and adult care food program, also known as CACFP, maternal and child health, school nutrition, farm to school, adolescent health, aging, extension programs, nutrition and physical activities. That's just naming a few of them. There's even more. So it really is kind of an extensive area to work in, that a lot of people and dietitians are just not aware of. So, funny enough, I didn't plan to work in public health nutrition. That wasn't really my goal when I was in school. But once I got here, I knew I had found my place. I had found my people. I'm incredibly passionate about this work that I do. So, at ASPHN, that's as a consultant, that's where my main contract is through. So, consultants who are contracted through ASPHN support a wide variety of projects. So it could mean managing grants, coordinating councils or committees, planning trainings, providing technical support to our members. That's just kind of a few of the areas that we work on. My main project with ASPHN is managing a grant from CDC. It's called the Developmental Monitoring in WIC project. So this is how I am indirectly involved with the WIC program currently. I've led this grant for the past 7 years in partnership with CDC, and then now AAP is also partnering with us on it. The goal of this project is to integrate developmental milestone checklists or developmental monitoring into WIC visits to help identify children who might need early intervention. When we started 7 years ago, we had only 9 state WIC programs who were a part of the project. And now we're up to 26 and continue to grow every year because there is so much interest in developmental monitoring in the WIC program. So that's my main project with ASPHN. I also help support several committees and councils. So committees in ASPHN are kind of what helps move forward our strategic plan, and councils are sort of like a member interest group. Each of these groups, councils and committees, have volunteer chair people who run them essentially, and I help support them. We do things like planning education opportunities, continuing education, networking opportunities, outreach opportunities, things like that. As a consultant, I work 100% virtually in this position. I am self-employed, so I don't have a traditional boss that I report to. I manage my own schedule, and kind of as long as I meet the deliverables in my contract, I get paid. So it's a little different than your traditional job, if you will. And honestly, that flexibility is one of my favorite parts of this job, especially as a mom to 5 kids. I don't know how I would go into an office every day. But I also love that the work I'm doing truly feels like it makes a difference in people's lives. So I would say to thrive in a role like this, you need to be very self-motivated. You don't have someone there telling you what to do every day. You don't have a boss that says, these are the things you need to do, or this is your schedule for the day. You kind of just have to figure things out. You manage your time, and you need to stay organized in order to kind of be on top of all of the things that are in your contract. You also need to be pretty versatile. Sometimes there's no one to handle certain things. And so it falls on you. And part of that is like you just don't have the extra funding to pay somebody to do design work or admin tasks or things like that. So you'll kind of be doing a bit of everything as well. So like in my role, I've done some finances, some graphic designing, some marketing, some logistics, social media, things like that. So you kind of just have to be adaptable and willing to learn new skills, figuring out how to use AI to your benefit, getting online and figuring out how to do these different tasks that maybe you weren't trained to do. One of the biggest challenges in this area is definitely funding. All of this work is totally dependent on government support, and with recent shifts in public health funding, I won't get into politics here, but the future is pretty uncertain at the moment. Public health is a little bit under attack at the moment, which is frustrating. And a lot of the industry, public health industry, is just very uncertain at the moment. So that is something that is frustrating and really hard to deal with, but it's also just kind of part of working in public health. So something to be aware of. So if you are thinking about a career in public health nutrition, my number one tip would be to connect with people in the field, learn more about what opportunities are available in public health nutrition. ASPHN is actually a really great place to start because it is a good majority of public health nutritionists throughout the country are a part of that organization. You can connect with people, find people in your state or in other states to try to connect with. You can also become a student member, and they have student networking events. We're planning a career fair to just kind of share more about what public health nutrition is, what opportunities are available there, things like that. So that's a good place to start. Also, just if you want to connect with me to ask me questions or advice on where to get started, I'm happy to help as well. So this career path is not always the most glamorous or well-known career, but I really do think it is truly meaningful in a lot of people's lives, and that we do make a huge impact on the overall well-being of especially many underrepresented populations. So if you are passionate about helping families, helping shape policy, creating healthier communities, then public health nutrition might be a perfect fit for you, just like it was for me. Like I said, I truly do feel like I have found my place. I've found my people. I love connecting with other public health nutritionists, and just know how vital this work is. So that's just a little bit about me and my path in dietetics. So thanks for taking the time to listen to me. I'm happy to answer any questions or connect with any of you. Jen, Professor Day can pass on my information, and I'm happy to hear from any of you. So thank you.